State of cannabis.
This is the State of Cannabis News Digest, a roundup of this week's key developments in the cannabis industry. Our top stories.
At the federal level, the White House is weighing a potential reclassification of marijuana that could reshape the industry, while Congress moves to sharply restrict hemp-derived products. Those decisions are already rippling outward, as states grapple with how tightly cannabis should be regulated, taxed, sold, and consumed. Several states are rewriting their rulebooks. Ohio lawmakers are poised to tighten voter-approved legalization. Michigan is preparing for higher cannabis prices after a major tax increase survives a court challenge. In New York, leadership turmoil follows the collapse of a high-profile enforcement case, raising new questions about oversight and accountability. Elsewhere, the debate is about access and control. Florida lawmakers are revisiting whether medical patients should be allowed to grow their own cannabis. Kentucky is opening its first licensed medical dispensary, marking the start of a long-awaited market. Massachusetts is preparing to allow legal places for social cannabis use, while Maine voters may soon be asked whether to roll back legalization altogether. And in Oregon, concerns over testing, labeling, and safety are colliding with a broader national fight over the future of hemp. Stay with us for the details as we take you state by state through the latest developments shaping the future of cannabis policy in the United States.
And now here is the deeper look at the key events in the cannabis world this week.
Federal cannabis policy may be on the brink of one of its most significant shifts in decades. Multiple reports suggest President Donald Trump is considering issuing an executive order that would move marijuana from Schedule 1 to Schedule 3 under the Federal Controlled Substances Act. Such a move would fundamentally change how the federal government treats cannabis, even though it would stop short of full legalization. The White House has attempted to downplay the speculation, saying no final decision has been made. But according to reporting from the Washington Post, Trump recently met in the Oval Office with marijuana industry executives, Health and Human Services Secretary Robert F. Kennedy Jr., and Centers for Medicare and Medicaid Services Administrator Mehmet Oz. During that meeting, Trump reportedly placed a phone call to House Speaker Mike Johnson, who has expressed opposition to rescheduling marijuana. Advocates and critics are interpreting the same developments in very different ways. Prohibitionist groups, including Smart Approaches to Marijuana, warn that rescheduling could provide major financial benefits to large cannabis companies while sending what they see as the wrong message to young people about drug use. Industry leaders and reform advocates, however, argue that moving cannabis to Schedule 3 would finally acknowledge its medical value and eliminate the long-standing tax penalty created by IRS Code 280E, which prevents cannabis businesses from taking standard deductions. If Trump ultimately approves the change, he would be completing a review process that began under the Biden administration, which concluded, after reviewing scientific evidence and data from state cannabis programs, that Schedule 3 was more appropriate. The timing is notable, coming shortly after Trump signed legislation banning most hemp-derived THC products, signaling that federal drug policy is entering a period of rapid and sometimes contradictory change. For patients, businesses, and state regulators, the implications could be significant. While Schedule 3 would not legalize cannabis nationwide, it could lower costs for licensed operators, expand research opportunities, and influence states that continue to cite federal law as a reason to delay reform. Whether or not the executive order materializes, the renewed attention on rescheduling suggests cannabis policy may be entering a new and unpredictable phase.
Those federal tensions are already showing up at the state level, particularly in Oregon. The Oregon Liquor and Cannabis Commission has issued a recall for a batch of hemp pre-rolls after discovering they contained far more THC than advertised. The affected products, sold under the Simply Sol brand and labeled with a September 5, 2025 date, were marketed as hemp but tested at THC levels high enough to raise public health concerns. The products were sold at dispensaries across the state under strain names like blood orange, cornucopia, lemongrass, piña, and pink panther. Regulators say the elevated THC levels pose a particular risk to consumers who believed they were purchasing low-THC hemp products. Retailers have been instructed to immediately remove the items from shelves, and consumers are being told to destroy any products they have already purchased. An investigation is now underway to determine how the excess THC ended up in the pre-rolls and how the products passed through testing and regulatory systems before reaching consumers. The Commission is asking anyone with information to contact the agency directly. For the broader cannabis and hemp industries, the recall is a reminder that accurate testing and labeling are essential, not just for compliance, but for consumer trust. At the federal level, Oregon's U.S. senators are attempting to prevent an even broader disruption to the hemp market. Senators Ron Wyden and Jeff Merkley have reintroduced the Cannabinoid Safety and Regulation Act after Congress passed a funding bill that would effectively ban most consumable hemp products nationwide next year. Their proposal would preserve access to hemp-derived products, including CBD and certain THC items, but only under a national regulatory framework. The bill would cap THC levels, restrict sales to adults 21 and older, ban synthetic cannabinoids, and give the Food and Drug Administration authority over testing, labeling, and recalls. Supporters say the approach would protect consumers and thousands of jobs, while critics argue it is long overdue oversight for a market that has grown faster than regulators could keep up.
In Maine, the future of legal cannabis could be headed in a very different direction. State officials have approved a request allowing activists to begin collecting signatures for a 2026 ballot initiative that would roll back most of the state's adult-use cannabis law. The proposal would preserve legal possession but eliminate recreational cannabis sales and home cultivation, effectively dismantling the regulated adult-use system voters approved in 2016. It also includes major changes to the medical cannabis program, including mandatory testing for contaminants, expanded labeling requirements, and the creation of a statewide tracking system covering all cannabis products from cultivation to sale. Supporters of the initiative, including organizer Madison Carey, argue that Maine's cannabis market needs stronger oversight and fewer retail outlets. Critics, such as Representative David Boyer, warn that the proposal could unravel a large and growing industry and threaten thousands of jobs across the state. Activists must gather nearly 68,000 valid signatures by February 20, 26, for the measure to qualify for the ballot. If voters ultimately approve it, the changes would take effect in 2028. In the meantime, patients, business owners, and consumers are bracing for years of uncertainty as the debate over the future of cannabis in Maine intensifies.
Massachusetts is moving forward with a long-anticipated change to its cannabis system: legal social consumption. The state's Cannabis Control Commission has approved regulations allowing licensed businesses to permit adults to use cannabis on-site. The new rules open the door to traditional cannabis lounges and dispensary-based consumption areas, as well as less conventional spaces, such as yoga studios or event venues, provided they meet regulatory standards and receive local approval. The Commission has emphasized social equity and public safety, reserving the first wave of licenses for participants in its social equity program, which focuses on communities disproportionately harmed by past marijuana enforcement. License holders will face strict requirements. Businesses must provide food and water, maintain a rideshare or transportation plan for customers, and may not allow alcohol on site. Regulators say these measures are designed to reduce impaired driving and provide a safer alternative to public consumption or illegal use in housing where smoking is prohibited. Local control remains central. Even with state approval, cities and towns are not required to allow social consumption venues. Each community will decide whether to opt in and how these businesses fit into local zoning and neighborhood character. Dispensary operators say the change addresses a long-standing gap in the law. Customers frequently ask where they can legally consume cannabis they've purchased, especially renters and visitors. While it will likely be months before licenses are issued, social consumption in Massachusetts is no longer theoretical. It's now a matter of local decisions and implementation.
Florida's medical marijuana program could be headed for one of its most notable changes since its creation. Senator Carlos Guillermo Smith has introduced legislation for the 2026 session that would allow qualified medical cannabis patients to grow up to 6 flowering plants at home. Under the proposal, patients would need to be at least 21 years old, keep their plants secured, and stay within the legal limits or face penalties under existing drug laws. The bill would also explicitly allow licensed dispensaries to sell seeds and clones directly to patients, something that has not been clearly permitted under Florida law. The timing is significant. Florida's medical marijuana registry is nearing 1 million patients, many of whom complain about rising costs and limited product selection in a market dominated by a small number of large operators. Advocates argue that even limited home cultivation could give patients more control over their treatment and reduce monthly expenses. Lawmakers have rejected similar proposals in the past, and courts have ruled that Florida's 2016 Medical Cannabis Amendment does not guarantee a right to home grow. The bill also arrives amid an ongoing push to place adult use legalization back on the 2026 ballot and new enforcement rules that revoke medical registrations for people with certain drug convictions. If approved, the home grow law would take effect July 1st, 2026. Whether it passes or not, the proposal offers a glimpse into how Florida's tightly controlled cannabis system may be evolving.
If you live in a state where medical cannabis is legal and you're looking for a clear, straightforward way to schedule a medical cannabis evaluation, there's a simple option worth knowing about. StateCannabis.org is a nationwide network of state-specific cannabis industry information websites. In states that allow medical cannabis, the platform connects local patients with licensed medical providers who offer telehealth or in-person evaluations, depending on state rules. Here's how it works. First, follow the link in this podcast's description to visit statecannabis.org. Once you're there, select your state from the list. If you land on the home page, navigate to the medical category for your state. From there, you can schedule an appointment using the provided form. In many states, patients can be seen by a licensed medical provider in as little as 15 minutes, depending on availability. The process is designed to be simple, transparent, and state-specific, with clear information about medical requirements and next steps. The best part is that no account creation is required. Again, you'll find the direct link in the description of this podcast episode. That's statecannabis.org, where cannabis policy, education, and medical access meet, state by state. Kentucky will take a major step in its medical cannabis rollout this weekend as the state's first licensed dispensary opens in Beaver Dam. Governor Andy Beshear announced that the Post dispensary will begin serving patients Saturday morning, selling products grown by Farm-Tucky, the first licensed cultivator to complete all regulatory steps required to bring cannabis to market. The governor says this marks the first time Kentuckians with qualifying medical conditions will have access to regulated cannabis inside the state. He's also warning patients to expect long lines and limited supplies, with more than 23,000 people already certified to participate in the program. Dispensary operators say the opening represents the culmination of more than a year of work involving licensing fees, compliance inspections, zoning approvals, and a relocation from Henderson County to Beaver Dam. Local officials say the city has supported the project from the start. Kentucky has now approved 16 cultivators, 48 dispensaries, and 6 testing laboratories statewide, along with more than 500 physicians certified to recommend medical cannabis. After delays in the program's launch, Beshear has waived renewal fees for patients and maintained protections for those legally purchasing cannabis out of state during the transition. For many patients, especially those managing chronic pain or serious illnesses, Saturday represents long-awaited access. For the state, it marks the beginning of a regulated market expected to expand quickly.
Ohio's cannabis and hemp industries are preparing for a sweeping rulebook rewrite contained in a single piece of legislation. Senate Bill 56 has cleared both chambers of the legislature and is now awaiting action from Governor Mike DeWine. The bill responds to issues that have emerged since voters approved adult-use cannabis in 2023 and sales began in August 2024. On the hemp side, SB 56 would effectively shut down the open market for intoxicating hemp products, limiting sales to licensed dispensaries, and requiring full cannabis-style testing and labeling. A temporary allowance for 5 milligram THC beverages would remain in place until the end of 2026. On the marijuana side, the bill tightens several provisions voters approved. It bans all public consumption of adult-use cannabis, including edibles, makes possession of out-of-state cannabis illegal, and requires any opened cannabis products or paraphernalia in vehicles to be stored in a trunk or rear cargo area. The bill keeps home grow legal at 6 plants per adult and 12 per household, but adds new penalties for exceeding those limits. It also lowers THC caps, limits the number of dispensaries statewide, and keeps the existing 10% excise tax structure. If Governor DeWine signs SB 56, many of its provisions could take effect as early as March, leaving consumers and businesses only months to adapt.
In Michigan, cannabis consumers may soon see higher prices. A judge has allowed a new 24% wholesale tax on adult-use marijuana to take effect January 1st. The tax is part of the state's road funding plan and comes on top of the existing 10% cannabis excise tax and 6% sales tax. Industry groups warn the increase could drive some consumers back to the illicit market, but the court ruled the tax is allowed under Michigan's legalization law, while a broader legal challenge proceeds.
New Jersey officials are asking residents to help decide how cannabis tax revenue is spent. The state's Cannabis Regulatory Commission will hold 3 virtual public hearings in January 2026 to gather input on the social equity excise fee. Under state law, that revenue must fund programs in communities disproportionately impacted by past marijuana enforcement, including job training, housing, and reentry support. Separate Zoom hearings will be held for North, Central, and South Jersey, with opportunities for residents to speak or submit written comments online.
This was the State of Cannabis News Digest, available weekly. You can listen to us on all main podcast platforms. To make sure you don't miss out on the latest updates and in-depth analysis of the cannabis industry, be sure to subscribe to our podcast. By subscribing, you'll get notifications for each new episode, helping you stay informed and ahead in the ever-evolving cannabis market. Join us next Saturday for more insights. Until then, keep thriving and stay green.